We're going to figure out what gives us breast cancer and how we're going to deal with breast cancer, because I just saw a number that's just so staggering that almost 300,000 people, women, I guess, predominantly, uh, who will have breast cancer. And, this is not we're good news, and it's not good news, but we're going to hear some updates here. And we have a brave breast cancer patient, I guess it might be the right word here. And we're going to talk about, and thank you for doing that. That's very honorable. A drop in early breast cancer diagnosis tied to the pandemic. That's not good news. But we have Dr. Ahmed Elkhanani, who's a breast cancer expert at the University of Alabama at Birmingham. Hope I did okay with your name here.
Never said it beautiful.
I did. Oh well, all righty. I feel good about that. What is it with breast cancer? I mean, there's not going in and getting checked out is one thing, but how come we can't get it? I mean, I've done 100 stories on it and cancer. We can't get a grip of it. Why do you think it eludes the researchers? And even though they're all spending lots of time and money on it, what is it?
Mm-hmm.
What do you think? What's your thought?
Right. Well, the short answer is heterogeneity, or meaning, you have so many different types of breast cancer. Not two are the same. You have three main types: hormone receptor positive, triple negative, and HER2 positive. They're all treated very differently, and they're all motivated by different biologies, if you will. And to find that perfect, silver bullet remains tricky.
Does it change? I mean, you said there's different ones. Could a woman have a certain type and then it becomes another type at the same time? I mean,
right. So usually no, but it can happen. But usually that's the exception to the rule. Now, although we're talking about treatment, I want to take a step back and actually remind everybody that prevention is key. So early detection is actually quite important in these diseases, because we know that early detection leads to better outcomes and improved survival. For example, that's exactly why mammograms are recommended to improve patient survival. Now, admittedly, the pandemic did throw a wrench in there with the early screening and mammograms, and that led to, just like you mentioned, an increase in late stage cases and patients that come in with more advanced disease.
So an early detection gives you as a doctor a better opportunity to treat it as much as we can. Do people actually get cured from breast cancer?
So, I'll tell you that there are, as I said, three main types, and one of the most important advancement that happened in the past, few years has been in the HER2 positive breast cancer. And that advancement has been using specific treatments that can actually navigate through the body and kill the HER2 positive breast cancer cells. And one example of that type of medicine is Phesgo, which is an injection that is two medicines combined that circulate through the body and kill HER2 positive breast cancer cells. And these drugs have drastically improved the rate of what we call complete response, improved the rate of cure in early stage breast cancer, and control of late stage breast cancer. Now, Phesgo, for example, is indicated in these two settings, which is high risk early breast cancer before or after surgery, and in stage 4 breast cancer. Similar to some of the medicine that realm, it is associated with some heart and gut issues and problems with the complications in pregnancy. So definitely speak with your doctor, see if that fits your treatment landscape.
Okay, let's go to our patient here. I'm not sure your first name, but at this moment, I'm going to call you Brave One. Tell us about your experience here.
Absolutely. So my name is Melissa,
Okay.
and I was diagnosed back in 2010 with stage 3 breast cancer. And just shy of 2 years, it had metastasized and come back at stage 4. So I've been living with stage 4 breast cancer for a number of years. And as you can imagine, over the course of those years, had various different treatment plans. I am thrilled to be here partnering with Genentech to talk about my most recent treatment, which is Phesgo.
Uh-huh. And so, and first of all, how did you find out about Phesgo? Is the doctor who's with us here, is that your doctor or is somebody else, your main physician?
He, Dr. Alkamani, as amazing as he is not my personal physician,
Okay.
but I found out about all of my treatment options from my oncologist. Building a bond with your doctor is everything. They will map out all the different options. Knowledge is power in the situation with living with breast cancer.
And what part of you live in America?
I do. I live in New Jersey.
New Jersey, that's not America. No, yes, it is. I'm from New York. No, even though it's New
Ouch!
York, New
Ouch!
Jersey, yeah. No, New Jersey, much better, much better. And so, in any case, well, there's a lot of good hospitals in New Jersey. Plus, you got a lot of good pharma companies in New Jersey. I mean, that's probably more pharma companies than any place in America. So I don't know which hospital you're working with, but I do know that they have very, very good care. So you were fortunate. So I will say, but I mean, 2010. I mean, come on, this is 22. So and you look strong. And how should somebody handle this once they learn a little bit that they have it? I mean, first they got to find it. Now, we were talking about making.
Well, it's early
checked out.
detection is key.
Right.
Yeah, early detection is key. 2, speak with your doctor. Knowledge is power. And then lastly, I would say to learn more, it's breastcancer.org. Phenomenal website to get all the information you're looking for. And if you want to learn a little bit more about the treatment that I'm on and we've talked about today, phesgo.com, Phesgo.
Okay.
And thank you.
And thank you, Doctor. Let me ask you one last question. The future here. Do you see R&D really coming to the table more so, or is this Phesgo? If I'm saying that right, has that been out for a while? I mean, for
So I could tell you, right. There's so many advancements coming every week in breast cancer, and for people who want to learn more about that particular drug we're talking about, they can go to the website. But it's a bright future for our breast cancer patients.
Okay, optimism. Good. Well, congratulations.
Exactly.
All right. Well,
Thank you.
That's good news. Thanks a lot. Bye-bye.
Thank you. Appreciate it.
Thank you.